You. Compulsively playing video games now qualifies as a mental health condition. The World Health Organization recently revised its disease classification manual, adding gaming disorder as an addiction. News has raised plenty of concern from parents.
Absolutely. And joining us now from Providence St. John's Health Center in Santa Monica, Dr. Daniel Ganjian. Dr. Ganjian, thank you so much for joining us today.
Pleasure.
I bet a lot of parents are talking to you about this. So how would you know the difference between someone who just plays a lot of video games from someone who really has a mental health condition regarding these video games?
Good question. The mental health addiction only exists in 1 to 3% of the children who play the video games, so it's not so common. Nevertheless, you would know it if they exhibit 3 main signs. If they can't control their behavior, even if there's negative consequences. If they're prioritizing playing video games over other things and everything else is in the periphery. And the third thing is if it takes over their life and there's impairment in their educational, occupational, family, social interactions, then you know that there could be an addiction going on, especially if it's going on for at least 12 months.
With a classification like this, do you think it's going to raise unnecessary concerns, though, among parents? Like, oh my God, my kid's an addict. You know, what do you think about that?
It's a good question, but the truth is it lets parents know to just watch out. Don't give your kids free control over their tablets and their internet electronics playing as much as they want. They should have limits to it. Amount of screen time should be limited to 1 or 2 hours a day. There should be a family media use plan. How much time are you allowed to play on it, and what are the different applications that you're allowed to use? Even the popular social media is kind of like games because you have to get a number of likes, and whoever has the most likes wins. So oftentimes that can lead to an addiction in and of itself.
Wow, I'm still fascinated by the amount of time, if you're seeing the signs in your kids, how do you have a conversation? Because you have daughters, I have sons. I feel like if I were to try to take it away or something, that would cause another problem. And then you kind of just give in and go, okay, we'll take it, because it's, I don't know, how do parents have to like actually get involved and take that away?
The best way is to, instead of saying don't play video games, tell them to do something else that they enjoy to do. Go to play basketball, go fencing, go do, take out the trash, something else. Focus on that. Instead of saying don't this, don't that, that's going to cause awkwardness. What you want to do is you want to also speak to them, let them also read the research, or let the doctor tell them about what's going on, so that they know that, hey, this is for my own best interest. It's not just coming from mom who's annoying me, it's coming from the doctor himself.
Are there ages that are specific in this sort of problem? Have you seen it younger and younger, or is it adults? And
Yeah, actually, it's going younger and younger. We're seeing it. Even little kids are coming into my office on that iPad, and they're really good at maneuvering around it. I've seen as young as 6 months old know exactly how to turn on the app.
Oh, goodness.
But oftentimes, when does it become an addiction? It's mostly, usually around the ages of 9 to 15, I'm seeing a lot of it. So those are the times that you have to watch out for.
All right. Well, very, very good information. It's always eye-opening for when you talk about something, because we do see kids on their computers and tablets and their parents' phones all the time. So
exactly.
Something.
I saw a 6-month, well, not maybe a 9-month-old baby trying to open a phone one time at dinner. I'm like, that baby has a phone in this little hand. How's it even holding a phone?
It's incredible. They're smart.
Yeah, they're very smart. They know how to change the settings, and the parents don't know how to change it back again.
Yeah, it's incredible. Well, thank you so much, Dr.
My
David
pleasure.
Ganjian, joining us to talk about this. Again, hopefully we'll see you again in the future when addiction of this is kind of get a handle on it, at least for parents. All right.
Thank you.
Thanks again.
Thank you.
Well, stay with us. Still ahead, an incredible rescue.
A deaf hiker falls almost 700 feet down